would you mind just talking again? What is a DVA? What are the indications for a DVA? How do you talk to your doctor about it? And what is the process by which, it effectively improves the circulation, how
Mhm.
long it lasts, and that kind of thing. It doesn't last very long. So my whole point there is it's supposed to just get enough blood flow to heal the wound and get you back on your feet to walk, right?
Yeah, so DVA, we reserve it as currently I call it the nuclear option, meaning that you truly, by an expert, can be told that you don't have any normal arteries in your foot to connect anything to, whether by surgery or from the fancy wires, tools, access points that any of us on the complex level do. We call that a desert foot. And a lot of people with diabetes, kidney failure, and smoking have what we call a desert foot, meaning your arteries above your knee in your knee can all be sort of okay, but then when you get to the ankle and foot, it kind of becomes wispy little straws and it's kind of like a desert. So in those patients, there's no magical cure for blood flow. And if you have a wound in your toe, in your front of your foot, nothing we do from a vascular standpoint up till, DVA, could we do anything? So your only option was truly let's say I did the angiogram and I say you have a desert foot 10 years ago, your only option is a major amputation when it's needed. Over the years now, several of us around the world, from the inside, like an angiogram, we go down your leg into your arteries below your knee, and wherever typically one of the vessels will jump across into the vein next door and we direct the blood flow to the vein, which typically is supposed to bring blood back to your heart. Instead, in that one vein, will force blood down your leg. That's a little unnatural for your body. But what we've seen that happens is if that path that we create stays open, after about 6, 8 weeks, your foot starts opening up either arteries that have been asleep, small ones, or it starts helping form new blood vessels. So that's what's called a DVA, deep vein arterialization. So we're making a vein try to act like an artery that's within your own body. Now, there's a lot of unknowns. Those of us who've done it, I've been doing it for about 5 years now. There's things that we learn all the time. And luckily, we have a network of people around the world that we learn from each other. We've adapted. Our data and the best data we have says if you're a candidate for it and you have a stable wound, about 60 to 70% of patients that have a DVA can save their foot to walk, meaning at least only to a TMA, which is a transmet amputation. So just all your toes are gone, but you can still walk on a healed TMA. 60 to 70% uh, limb salvage rate. Now, within that population, that we found that patients on end stage on renal failure on dialysis, they unfortunately have slightly lower success rates, but it's not zero. So my answer is, if we have a stable wound and you truly have a desert foot, even if it's 50% is better than 0% if you're willing to take that journey. It's not a magical bullet. When I do these cases, I talk to the patient, their families. I say, this is going to be a little bit of long-term management. I need to know who's doing your wound care if it's not me or one of my people. I need to talk to them because you can have swelling, you can have early infection. Your wound can look a little nasty in the first few weeks, and you have to have a surgeon, a podiatrist, someone who knows what they're doing to say, we can watch it right now. If they have to have a surgery after the DVA too early, they need to be able to do what's called an open amputation to allow your tissues to continue perfusing before they try to close it down the road. So it's not a quick magical bullet, but if you're at the point of a major amputation, if you have the potential to walk, if your wound is stable, and you are willing to go through a journey to save your leg, then I offer it. So there's a lot of nuances to this. I have a patient that's 5 years out. His DVA is down, and that's okay. We've found that if the DVA shuts down after that 2 month mark, the process has already started where it's okay that it's down. That's what we're finding out. So he's 5 years out and he still has a foot that's got an amputation that's healed, but his DVA has been down for, doesn't matter. Doesn't matter to me because your wound healed and you're not in rest pain. So there's a lot of nuances and only a few of us out there are doing a lot of them, but you can ask that question. And if you can't get an answer, Google, because a lot of us are, I get patients from internet searches, from being part of trials. You can search these things, ask people, ask Kim,
Yep,
who are
we
the
have
people
all the
that
names.
who are the people
We
that
know
have
who's
done
doing
these.
them.
There's a circle of people of all of us who talk to each other and can
Yeah.
help find someone sometimes who maybe we know how many they've done. There's not a lot of people that have done a ton, but we're all trying to educate each other and teach people. The problem a lot of people won't do it is it takes a lot of procedure time, it takes a lot of
Yep.
costly equipment. So unfortunately, we live in a world where people live on an economic basis, and so they may not offer it or do it. Now that's when you got to say, why can't this be an option? And can you send me to someone who can do it?
And
Um,
that's really important. And so if you go to padhelp.org or call our Leg Saver hotline at 415-320-7138, we can help you find a doctor that can consider, at least review your case and see if this might be an option for
yeah.
you. And so, yeah, I tap into to Dr. Madassery all the time. Hey, do you know someone here? Do you know someone there? Who would you trust your leg with
It's kind of
all the
like high
time?
school.
So
It is a close knit network of a
it
lot of us.
is.
So we do have friends around the country that we would at least be say, hey, do you know somebody in this area that we trust regionally? So it's not always possible, but people like Kim are a great resource to connect. It's like this. It's like a network when you think about like Minority Report or something like that, like Google. Kim's our Google.
Yeah, especially for P.A.D. I do have doctors that call me and say, "Hey, do you know?" But one thing I think that you brought up in terms of the DVA really quick was really important, that I love that you have that real tough conversation with them, because it's not for the weak. It's a real journey. It gets worse before it gets better. And there's a lot of pain associated with it. There have been a couple, we've had many a nights up in the middle of the night trying to walk them through, and you just got to give them hope and say, but you're keeping your leg, you're going to get through this. You will get through.
Yeah,
And so it's a
I
lot.
have an honest conversation. It's not my body, but I tell them there's nothing wrong with an amputation if that's what you want. It's your body. Many people can do okay with an amputation provided recovery goes fine, provided they can get a prosthetic. There's a lot of caveats, but doing something that's on the newer edge also has a lot of caveats. So
Yeah.
I tell them, if you don't want to go through all this, you got to be okay with this, and the family has to be okay with it. To say I'm okay with that, that's a personal choice. We want to do these things for patients. Say no, absolutely not. And even if it ends up in that, at least I know I tried everything. That's what I tell them they have to be okay with.